So today I'm going to be reading an article from the NOBA website titled ADHD and Behavior Disorders in Children. It's written by Richard Milich and Walter Roberts from the University of Kentucky. I will add the link to the article in the comments below in case you guys wanted to follow along or maybe take a look at the article yourself. So it begins ADHD and behavior disorder in children. Attention deficit hyperactivity disorder is a psychiatric disorder that is most often diagnosed in school-aged children. Many children with ADHD find it difficult to focus on tasks and follow instructions, and these characteristics can lead to problems in school and at home. How children with ADHD are diagnosed and treated is a topic of controversy, and many people, including scientists and non-scientists alike, hold strange beliefs about what ADHD is and how people with the disorder should be treated. This module will familiarize the reader with the scientific literature on ADHD. First, we will review how ADHD is diagnosed in children, with a focus on how mental health professionals distinguish between ADHD and normal behavior problems in childhood. Second, we will describe what is known about the cases of ADHD. Third, we will describe the treatments that are used to help children with ADHD and their families. The module will conclude with a brief discussion of how we expect that the diagnosis and treatment of ADHD will change over the coming decades. Introduction. Childhood is a stage of life characterized by rapid and profound development. Starting at birth, children develop the skills necessary to function in the world around them at a rate that is faster than any other time in life. This is no small accomplishment. By the end of their first decade of life, most children have mastered the complex cognitive operations required to comply with rules, such as stopping themselves from acting impulsively, paying attention to parents and teachers in the face of distraction, and sitting still despite boredom. I'm sorry. Let me adjust this so I stop making mistakes. And sitting still despite boredom. Indeed, acquiring self-control is an important development task for children because they are expected to comply with direction from adults, stay on tasks at school, and play appropriately with peers. For children with ADHD, however, exercising self-control is a unique challenge. These children oftentimes, despite their best intentions, struggle to comply with adults' instructions, and they are often labeled as problem children and rule breakers. Historically, people viewed these children as willfully non-compliant due to moral or motivational defects. However, scientists now know that the non-compliance observed in children with ADHD can be explained by a number of factors, including neurological dysfunction. The goal of this module is to review the classification, causes, consequences, and treatments of ADHD. ADHD is somewhat unique among the psychiatric disorder in that most people hold strong opinions about the disorder, perhaps due to its more controversial qualities. When applicable, we will discuss some of the controversial beliefs held by social critics and lay people, as well as scientists who study the disorder. Our hope is that a discussion of these controversies will allow you to reach your own conclusion about the legitimacy of the disorder. Why diagnose children's behavior problems? When a family is referred to a mental health professional for help dealing with their children's problematic behaviors, the clinician's first goal is to identify the nature and cause of the child's problem. Accurately diagnosing children's behavior problems is an important step in the intervention process because a child's diagnosis can guide clinical decision-making. Childhood behavior problems can arise from different causes, require different methods for treating, and have different development courses. Arriving at a diagnosis will allow the clinician to make interference about how each child will respond to different treatments and provide productive information to the family about how the disorder will affect the child as he or she develops. Despite the utility of the current diagnostic system, the practice of diagnosing children's behavior problems is controversial. Many adults feel strongly that labeling children as disordered is stigmatizing and harmful to children's self-concept. There is some truth in this concern. One study found that children have more negative attitudes towards a play partner if they are led to believe that their partner has ADHD, regardless of whether or not their partner actually has the disorder. Others have criticized the use of the diagnostic system because they believe it pathologizes normal behavior in children. Despite these criticisms, the diagnostic systems has played a central role in research and treatment of children's behavior disorder, and it's unlikely to change substantially in the near future. This section will describe ADHD as a diagnostic category and discuss controversies surrounding the legitimacy of this disorder. ADHD is the most commonly diagnosed childhood behavior disorder. It affects 3 to 7% of children in the U.S., and approximately 65% of children diagnosed with ADHD will continue to experience symptoms as adults. The core symptoms of ADHD are organized into 2 clusters, including clusters of hyperactivity, impulsivity, and inattention. The hyperactive systems cluster describes children who are perpetually in motion, even during times when they are expected to be still, such as during class or in the car. The impulsive systems cluster describes difficulty in delaying responses and acting without considering the repercussions of behavior. Hyperactive and impulsive symptoms are closely related, and boys are more likely than girls to experience symptoms from this cluster. Inattentive symptoms describe difficulty with organization and task follow-through, as well as tendency to be distracted by extreme external stimuli. 2 children diagnosed with ADHD can have very different symptom presentations. In fact, children can be diagnosed with different subtypes of the disorder, according to the number of symptoms they have in each cluster. Are these diagnoses valid? Many lay people and social critics argue that ADHD is not a real disorder. These individuals claim that children with ADHD are only disordered because parents and school officials have trouble managing their behavior. These criticisms raise an interesting question about what constitutes a psychiatric disorder in children. How do scientists distinguish between clinically significant ADHD symptoms and normal instances of childhood impulsivity, hyperactivity, and inattention? After all, many 4-year-old boys are hyperactive and cannot focus on a task for very long. To address this issue, several criteria are used to distinguish between normal and disordered behavior. 1. The symptoms must significantly impair the child's function in important life domains. And 2, the symptoms must be inappropriate for the child's developmental level. One goal of this module will be to examine whether ADHD meets the criteria of a true disorder. The first criteria states that children with ADHD should show impairment in major functional domains. This is certainly true for children with ADHD. These children have lower academic achievements compared with their peers. They are more likely to repeat a grade or be suspended, and less likely to graduate from high school. Children with ADHD are often unpopular among their peers. Many of these children are actively disliked and socially rejected. Children with ADHD are more likely to experience comorbid psychological problems such as learning disorders, depression, anxiety, and oppositional defiant disorder. As they grow up, adolescents and adults with ADHD are at risk to abuse alcohol and other drugs and experience other adverse outcomes. In sum, there is sufficient evidence to conclude that children diagnosed with ADHD are significantly impaired by their symptoms. It is also important to determine that a child's symptoms are not caused by normal patterns of development. Many of the behaviors that are diagnosed of ADHD in some children would be considered developmentally appropriate for young children. This is true for so many psychologists and psychiatric disorders in childhood. For example, bedwetting is quite common in 3-year-old children. At this age, most children have not gained control over nighttime urination. For this reason, a 3-year-old who wets the bed would not be diagnosed with enuresis because his or her behavior is developmentally appropriate. Bedwetting in an 8-year-old child, however, is developmentally inappropriate. At this age, children are expected to remain dry overnight, and failure to master this skill would prevent children from sleeping over at a friend's house or attending overnight camps. A similar example of developmental appropriate versus inappropriate hyperactivity and noncompliance is provided in focus topic number 2. Why do some children develop behavior disorders? The reason that some children develop ADHD are complex, and it is generally recognized that a single cause is insufficient to explain why an individual's child does or does not have the disorder. Researchers have attempted to identify risk factors that predispose a child to develop ADHD. The risk factors range in scope from genetics to familial to cultural. This section will identify some of the risk factors that are thought to contribute to ADHD. It will conclude by reviewing some of the more controversial ideas about the causes of ADHD, such as poor parenting and children's diet, and review some of the evidence pertaining to these causes. Most experts believe that genetic and neuropsychological factors cause the majority of ADHD cases. Indeed, ADHD is primarily a genetic disorder. Twin studies find that whether or not a child develops ADHD is due in large part 75% to genetic variation. Further, children with a family history of ADHD are more likely to develop ADHD themselves. Specific genes that have been associated with ADHD are linked to neurotransmitters such as dopamine and serotonin. In addition, neuroimaging studies have found that children with ADHD show reduced brain volume in some regions of the brain, such as the prefrontal cortex, the corpus callosum, the anterior cingulate cortex, the basal ganglia, and the cerebellum. Among their other functions, these regions of the brain are implicated in organization, impulse control, and motor activity. So the reduced volume of these structures in children with ADHD may cause some of their symptoms. Although genetics appear to be a main cause of ADHD, recent studies have shown that environmental risks may cause a minority of ADHD cases. Many of these environmental risk factors increase the risk for ADHD by disrupting early development and compromising the integrity of the central nervous system. Environmental influences such as low birth weight, malnutrition, and maternal alcohol and nicotine use during pregnancy can increase the likelihood that a child will develop ADHD. Additionally, recent studies have shown that exposure to environmental toxins such as lead and pesticides early in a child's life may also increase risk of developing ADHD. Controversies on causes of ADHD. Controversial explanations for the development of ADHD have risen and fallen in popularity since the 1960s. Some of these ideas arise from cultural folklore, others can be traced to specialists trying to market an easy fix for ADHD based on their proposal costs. Some other ideas contain a kernel of truth but have been falsely cast as causing the majority of ADHD cases. Some critics have proposed that poor parenting is a major cause of ADHD. This explanation is popular because it is intuitively appealing. One can imagine how a child who is not being disciplined at home may be non-compliant in other settings. Although it is very, very true that parents of children with ADHD use discipline less consistently, and a lack of structure and discipline in the home can exacerbate symptoms in children with ADHD, it is unlikely that poor parenting alone causes ADHD in the first place. To the contrary, research suggests that the noncompliance and impulsivity on the children's part can cause caregivers to use discipline less effectively. In the classic series of studies, Cunningham and Barkley showed that mothers of children with ADHD were less attentive to children and imposed more structure to their playtime, relative to mothers of typically developing children. However, these researchers also showed that when the children were given stimulant medications, their compliance increased and their mother's parenting behavior improved to the point where it was comparable to that of the mothers of the children without ADHD. The research suggests that instead of poor parenting causing children to develop ADHD, it is the stressful effects of managing an impulsive child that causes parenting problems in their caregivers. One can imagine how raising a child with ADHD can be stressful for a parent. In fact, one study showed that a brief interaction with an impulsive and non-compliant child could cause parents to increase their alcohol consumption. Presumably, these parents weren't drinking to cope with the stress of dealing with the impulsive child. It is therefore important to consider the reciprocal effects of non-compliant children on parenting behavior, rather than assuming that parenting ability has an unidirectional effect on child's behavior. Other proposed causes of ADHD are dietary. For example, it was long believed that excessive sugar intake can cause children to become hyperactive. This myth is largely disproven. However, other diet orientation explanations for ADHD, such as sensitivity to certain foods, additives, have been proposed. These theories have received a bit more support than the sugar hypothesis. In fact, the possibility of certain food additives may cause hyperactivity in children led to a ban on several artificial food colorings in the United Kingdom, although the Food and Drug Administration rejected similar measures in the U.S. Even if artificial food dyes do cause hyperactivity in a subgroup of children, research does not support these food additives as a primary cause of ADHD. Further research supports for elimination diets as a treatment for ADHD has been inconsistent at best. In sum, scientists are still working to determine what causes children to develop ADHD, and despite substantial progresses over the past 4 decades, there are still many unanswered questions. In most cases, ADHD is probably caused by a combination of genetic and environmental factors. For example, a child with a genetic predisposition to ADHD may develop the disorder after his or her mother uses tobacco during her pregnancy, whereas a child without the genetic predisposition may not develop the disorder in the same environment. Fortunately, the causes of ADHD are relatively unimportant for the families of children with ADHD who wish to receive treatment, because what caused the disorder for an individual child generally does not influence how it is treated. Methods of treating ADHD in children. There are several types of evidence-based treatments available to families of children with ADHD. The type of treatments that might be used depends on many factors, including the child's diagnosis and treatment history. as well as parents' preference. To treat children with less severe non-compliance problem, parents can be trained to systematically use contingency management to manage their children's behaviors more effectively. For the children with ADHD, however, more intensive treatments often are necessary. Medication. The most common method of treating ADHD is to prescribe stimulant medication, such as Adderall. These medications treat many of the core symptoms of ADHD. Treated children will show improved impulse control, time on task and compliance with adults, and decreased hyperactivity and disruptive behaviors. However, there are also negative side effects to stimulant medications, such as growth and appetite suppression, increased blood pressure and insomnia, changes in mood. Although these side effects can be unpleasant for children, they can often be avoided with careful monitoring and dosage adjustments. Opinions differ on whether stimulants should be considered to treat children with ADHD. Proponents argue that stimulants are relatively safe and effective, and that untreated ADHD poses a much greater risk to children. Critics argue that many stimulants medications are similar to illicit drugs such as cocaine and methamphetamine. Long-term use may cause cardiovascular problems or predispose children to abuse illicit drugs. However, longitudinal studies have shown that people who take these medications are not more likely to experience cardiovascular problems or to abuse drugs. On the other hand, it is not entirely clear how long-term stimulant treatments can affect the brain, particularly in adults who have been medicated for ADHD since childhood. Finally, critics of psychostimulant medications have proposed that stimulants are increasingly being energetic but otherwise healthy children. It is true that the percentage of children prescribed stimulant medications has increased since the 1980s. The increase in use is not unique to stimulant medication. However, prescription rates have similarly increased for more types of psychiatric medication. As parents and teachers become more aware of ADHD, one would expect that more children with ADHD would be identified and treated with stimulant medication. Further, the percentage of children in the U.S. being treated with stimulant medication is lower than the estimated prevalence of children with ADHD in the general population.